Welcome to MedTech Minis on the JADA System. Today, we will be taking a look at the nurse's role in JADA placement, specifically preparation. Hi, my name is Aleesha Moffett, and I am a labor and delivery nurse at CHRISTUS St. Cabrini Hospital in Alexandria, Louisiana, and I am here to provide a nursing perspective on JADA. The nursing profession is centered around patient advocacy and ensuring the best and most effective care. As a nurse, identifying a patient's risk factors for abnormal bleeding and postpartum hemorrhage, or PPH, is key throughout the various stages of labor. Part of this evaluation process is also to look at patient factors that might preclude them from receiving certain medications or treatments if abnormal bleeding or postpartum hemorrhage is to occur. Certain medications are contraindicated for patients with asthma or hypertension. The nurse can help identify patients that might be treated with a device like JADA. Nurses must advocate for their patients. Having a discussion with the provider before delivery about the patient's individual PPH risk factors can help the care team collaborate on the treatment plan should the patient experience PPH or abnormal bleeding. A discussion with the provider allows the nurse to advocate for JADA placement in those situations when appropriate. It is important to know where JADA is stored at your facility so that the device is readily available for any delivery that might warrant placement of JADA. Having the device easily accessible is especially important for patients identified as high risk or who are not candidates for certain medications used to treat PPH. In addition to knowing where JADA is stored at your facility, preparing the delivery room for JADA placement can be a key step that is commonly missed. Make sure the delivery room has a working suction, a suction canister, and a vacuum regulator set to 80 millimeters of mercury, plus or minus 10 millimeters of mercury prior to delivery. It is helpful if this room readiness occurs in the bedside shift report. If in the OR, prepare the room and discuss which suction canister can be designated for JADA if needed. Additionally, the nurse should verify the availability of portable suction in or near the OR to ensure suction can be maintained during patient transfer from the OR to the PACU or other areas of the hospital. Now that we have talked about what goes into preparing for a possible postpartum hemorrhage, check out the next video on the nurse's role in assisting with placement of the JADA system. Thank you. This has been MedTech Minis on the JADA System. For more information, visit thejadasystem.com/training.